watching. Greetings to those who are watching live and also the ones listening to the recording, and welcome to this webinar, Sharing Perspectives on the Pharmacist Needs in Humanitarian Settings. So this webinar will focus on the FIP humanitarian program, and we'll also hear from different colleagues around the globe on recent disaster and emergency situations. Today, I'm Rúben Viegas. I'm the FIP Practice Development and Transformations Projects Coordinator, and I'm with Nur El-Tahla. She's the FIP Projects Coordinator for Equity, Sustainable Policy and Development, and we're both supporting the FIP humanitarian program in the last months and in the recent developments, and we're happy to be here co-moderating this session with you. Today, we'll have an incredible panel for a discussion. We will not, unfortunately, have our CEO, Dr. Catherine Duggan. She had some personal circumstances and she cannot join us, but we have Mr. Preparedness, this Vice President from Cameroon, and we have 5 examples of colleagues from Slovenia, Sudan, Morocco, South Sudan, and Ghana that they will present some experiences and some examples on how they supported as pharmacists contributed to disaster and emergency situations. And I'll present them all in due course. Just the usual announcements first. So this webinar is being recorded and live streamed via YouTube, so you can access the recording afterwards on the FIP events website. So this recording will be available on events.fip.org, and you can see all the events that we've been doing, and believe me, there is a lot of them in there. You can ask questions, so we're having a kind of a question discussion format. So if you have any questions, please let us know in the Q&A box so we can sort those out, and panelists can also see and reply there. You can also send some greetings in the chat from wherever you are, and if you want to highlight also any recent humanitarian and disaster and emergency situations in your countries, you can also use the chat. But if you have any targeted questions, please use the Q&A box. You can also provide feedback to webinars@fip.org, and we encourage you, if you're not a member, to join FIP as a member in this link. So regarding the program, there's a short introduction from me and Nur that will follow. Then we have some intro words from FIP Vice President Monsieur Prosper Yag before the discussion, and then we'll have the discussion with the 5 colleagues, Pharmaceutical Society of Ghana, Morocco, Sigma Pharm, Slovenia, Pharmaceutical Society, the Pharmaceutical Society of South Sudan, and then the University of Medical Science Technology of Khartoum. So we have all the colleagues that will join the discussion. And before the 90 minutes pass, we'll have a short wrap-up and conclusion for this event. So the learning objectives, we hope that you can learn a bit more and understand the FIP humanitarian program. That's why we'll do a presentation, short presentation at the beginning, discuss needs for pharmacists in humanitarian areas, especially with all the examples that are brought in this discussion, and then identify needs for interventions delivered by pharmacists. So what can pharmacists do in these humanitarian situations, and also regarding preparedness, because there might be new disasters coming soon, and we can have preparedness work for these future emergencies. So starting with the introduction, just an overview that humanitarian is a concept that means concerned with or seeking to promote human welfare. And of course, as pharmacists, this is part of our DNA. We are healthcare professionals. We have this need to help people, to promote health, and this is, of course, in line with everything we do as pharmacists. Disasters can be natural, man-made, they can be wars, can be civil disorders or pandemics, so there's differences, and there's a variety of them. And, of course, the United Nations and WHO, the World Health Organization, are also working in these situations because especially in big disasters, there's a disruption of the normal flow of healthcare, and we have no way to provide healthcare to people that need it. And just as a note, WHO pointed out in 2023, 339 million people are facing a humanitarian crisis. So there's a huge number of people, and you can see on the right side There's also a big list of countries that have emergencies ongoing, some for a lot of big period of time, some are more recent, but there are in a lot of countries and a lot of people are needing help regarding emergency situations. So this is just a number to put some idea of the weight that this problem and this program can have. Some of you might be familiar with the FIP development goals, which are the main areas that FIP wants to develop. And of course, the humanitarian program links to goal 18 as access to medicines, devices, and services, because, as I said before, in these situations, it might be hard to get a grasp to medicines or to services or to healthcare in general. But we have other issues such as patient safety, goal 19, people-centered care, or equity and equality that Nur will also mention in a bit. So the humanitarian program reaches most of these goals and most of these priorities. So it's an important program for FIP, of course. Historically, the military and emergency pharmacy section MAPS has been working in the managing of emergencies. Of course, this has been evolving and there's other roles, but this is one of the sections in FIP that's working closely with the humanitarian program. And in the bottom, you see also one example that a paper, a journal was published, and it's entitled the FIP and its Road to Support Ukraine. And we developed the examples and the support that was done in this specific case. And I think for now, I'll hand over to Nur. Thank you so much, Nur, and welcome to this event as well.
Thank you very much, Rúben, for that introduction, and thank you everyone for joining us today. So building on what Rúben has just mentioned, I'd like to highlight how this humanitarian work closely links to many different areas, but particularly to principles of equity and equality, as well as patient safety and sustainability, especially since it revolves around addressing the needs of vulnerable populations and ensuring fair treatment and access to care in all settings. So this can include addressing disparities, providing equal access to aid, ensuring gender equity, preparing for future pandemics and crises, ensuring sustainability, whether that was environmental, social, or economic sustainability. And we try our best to achieve all of this in all settings, but this is particularly important in humanitarian settings. Next slide, please. So with regards to gender issues, for example, we know there's been a sharp rise in the need for humanitarian aid due to the impact of COVID-19, combined with climate change, combined with conflict. And all of these crises tend to affect women and girls more than others in a society due to the impact on healthcare, on education, on gender-based violence. And by adopting gender-informed approaches, it's possible to better address this impact of humanitarian crises on women and girls and to find ways to reduce it. Next slide, please. As for the role of pharmacists, we know how important they are in contributing to the provision of healthcare services and support during crises. And this role can include medication management, for example, taking up roles in supply and distribution of medicines, and inventory control, preventing shortage or wastage of medicine. They can take part in patient care, for example, in medication counseling and adherence support. They can take part in clinical support by collaboration with healthcare teams, by treatment planning. They can take part in public health initiatives, such as health education, taking part in education campaigns, disease prevention campaigns, healthy practices campaigns, immunization programs. Pharmacists can also help in disaster preparedness and response in ways such as emergency supply management. So ensuring emergency medical supplies are always there, ensuring rapid response during crises, coordination with relief teams, to address the healthcare needs of affected populations. Quality assurance is another way, ensuring medication quality, ensuring medications are not expired, monitoring adverse events, contributing basically to overall patient safety. And lastly, training and capacity building, so they can take part in training of other healthcare professionals, especially in the context of disaster response and humanitarian aid. Next slide, please. So with all of this in mind, and in response to different crises and disaster situations, FIP commits to support pharmacy associations with an overview of the skills that pharmacists might need when working in disaster preparedness or emergency situations, liaise with national ministries of health and other relevant stakeholders to increase the impact and outcomes for pharmacists working in these settings, create visibility for the specific role pharmacists can also have to encourage colleagues around the world to engage in humanitarian activities, share among FIP member organizations any opportunities for engagement and success stories in these areas, promoting cross-collaboration, continuing to engage our stakeholders and empower our regional and national leaders and members to strengthen humanitarian work, and finally, to promote international collaborative work in humanitarian settings. Next slide, please. So as part of the FIP humanitarian program, we've hosted several digital events to highlight some lessons learned from countries that have faced humanitarian disasters, as well as the important role that pharmacists can play in those settings. So on our microsite, you can find several resources that FIP has published, including frameworks and guides, toolkits, and FIP commitments and policy statements, the latest of which was published in September of 2023. Next slide, please. One of the important FIP publications is the FIP Global Humanitarian Competency Framework. This was launched in 2021 with the aim to provide a set of competency standards for pharmacists and pharmacy technicians who are involved in humanitarian aid and disaster relief efforts. The framework was developed by FIP in collaboration with various stakeholders, including pharmacists, humanitarian organizations, and government agencies. And this framework, as you can see on screen, includes sets of competency standards that fall under the 4 domains. The first of which is the pharmaceutical care domain, such as conducting medication histories, providing drug information, managing medication therapy. The pharmaceutical public health domain, which has competencies on disease surveillance and response, health promotion, and health system strengthening. Third domain is organization and management, such as inventory management, logistics, and budgeting. And finally, the professional and personal development domain, such as self-awareness and cultural competence. So this framework is available in English, Turkish, and Arabic, and we're currently working with our member organizations to have it translated in as many languages as possible to make it accessible and useful for everyone. Next slide, please. FIP's humanitarian program also includes a dedicated section on pandemic preparedness and response, providing assistance beyond traditional humanitarian aid efforts by actively engaging in proactive planning and resource mobilization to tackle pandemics and disasters effectively. So by integrating pandemic preparedness within the humanitarian program, FIP acknowledges the importance of timely access to medication and healthcare during emergencies, which can significantly alleviate suffering and save lives. And FIP has published several reports on pandemic preparedness and response, all of which you can find on our website. Next slide, please. So everything I have just mentioned can be found on our humanitarian microsite, which is on the screen, humanitarian.fip.org. And if you have any questions, please feel free to add them to the Q&A box or to email me or Rúben for any inquiries. Thank you very much, and over to you, Rúben.
Thank you so much, Noor, for this presentation. I hope it was a good overview of the FIP humanitarian work, and if anyone wants to be involved, they can contact us through the webpage that you see on the screen, but also through our emails that we can leave on the chat box. So moving on, we have some intro words from FIP Vice President Prosper Viegas. Dr. Prosper is a doctor of pharmacy, graduate of University of Paris-Sabatier in France. He has over 35 years of experience in logistics, supply chain, and drugs in Africa. He's also an international pharmaceutical consultant, social entrepreneur, and advocate for quality of drugs access in Africa. He was also the president of the African Pharmaceutical Forum. He's currently now the FIP vice president. So we're glad to have Prosper here with us. So we'll give him the floor for some words. Prosper, the floor is yours. Thank you so much.
Thank you, Rúben. Do you hear my voice?
Yes, it's very good. Thank you.
Okay, because I'm not feeling well. Okay, dear colleagues, dear friends, good morning, good afternoon, according to where you are following us. It's an honor to be invited here for a brief introduction on a very sensitive topic that brings us together today on this platform, talking about sharing perspective on the pharmacist needs in humanitarian setting. I would like to start my intervention by giving you the example of my country, of what happened in 2016 in a small town named Ezeka. We had a railway accident with 80 people died, according to the official reports. 800 others were injured. Cameroon have never experienced this kind of situation. And what happened? The Ministry of Health called me. I was president of the Pharmaceutical Society of Cameroon. The minister called me and said, there is no pharmacy in this town. Why? We are facing many challenges. We don't have drugs. We are not sure of the quality of the medicine that are coming. We should have a pharmacist in the town. There was no community pharmacist. That shows that when there is a lack of pharmacists in the hospital, in community pharmacy, taking care of people in emergencies is very difficult. Pharmacists can play a fundamental role in taking care of emergency issue, emergency program, and so on. This can show you exactly how we can act. I'm not talking about what happened with COVID, where pharmacy were involved fully all over the world and did their own to reduce the pandemic. The various crises mentioned in Africa mention that Africa is experiencing today are climate crises, climate challenges, which led to the mass of displacement of the population, civil war in Sahel, in Sudan, in Cameroon also, in the north and in the west Anglophone part of the country. We are facing violence, terrorism. It's a very bad situation there. This has created massive displays from the region, the Anglophone region, to the Francophone region. And you have the earthquake disaster of Morocco, floods in Libya, and the pandemic, of course. What can do FIP? FIP has been involved in the declaration of World Health Workers Association in terms of crisis, even in the recent crisis in Gaza. to remind everyone that the protection of health workers is important. FIP has published a document on FIP, Global Humanitarian Competency Framework. Nuras highlighted this in his presentation. Supporting pharmacists in pharmaceutical workforce in the humanitarian area, version 1, FIP. These are good resources that can be used by local association, national association, sorry. Today, through the collaboration with Pharmacy Without Borders, the FIP should continue the implementation of Medicines for Africa project, the monitoring of this association, which will seek funds to support pharmacies in period of crisis across the region. Humanitarian setting should be an option in the training of pharmacists, in the education of pharmacists. Humanitarian action should be involved in the program. This includes the role of pharmacists during humanitarian crisis. What should be their attitude? Pharmacists should therefore be like Scout, ready to act in any situation, ready to act, prepared to act in any situation. Thank you very much.
Thank you so much, Prosper, for your effort in being here. I hope you feel better, you feel well, and you take some rest. It's very important, these intro words highlighting not only the global pandemics, but also, for example, the local situations that you mentioned, mostly in Africa. That's why we also have a lot of African countries represented here today, but there's also conflicts in other parts of the world at the moment. And this can go from a global pandemic, as you said, and even a local accident where pharmacists can play a role. So we have this magnitude of interventions that pharmacists can do. Of course, we also have the question of training that you said, but pharmacists need to know that there is an option if they want, that they can engage in these situations. And the part that you said about the protection of health workers is also very important, because if the health workers are not protected, then they can also not provide healthcare. They cannot provide any services. So they need to be protected. They need to be well in order to provide the best care for patients. Thank you so much, Prosper, for these intro words and for joining us today. We will move now to the introduction of our panelists. So I'll present them one by one, and then we'll move to the discussion, where I'll give them the floor and ask some questions so they can also describe their situations in their countries. And we'll start with Kwabena Santeofe, Vice President, Pharmaceutical Society of Ghana. He's a pharmacist for 15 years. He has worked in policy, government affairs for the last 13 years, championing local pharmaceutical manufacturing in West Africa, driving access to innovative medicines, and also he's leading the Medtronic labs in Ghana and drives partnership for this company in West Africa. He also has a background in law and has been a lawyer for 9 years. So, Kwabena, thank you so much for joining. Welcome to the panel. I'll be going to ask you some questions in no time. Thank you so much.
Thank you.
Our second speaker is Salami Noureddin. He's the President and Director General of Sigma Pharma GA from Morocco. Mr. Salami will be doing his intervention in French, so I will ask him the questions in French, and then I will translate the highlights of the intervention back to the discussion. He's pharmacist since 1999, also the ex-president and founder of l'Amicale des Pharmaciens du Maroc, so association in Morocco, and also president and founder of the first groups of economic interests in Morocco, Sigma Pharma GA. Monsieur Salami, merci pour nous rejoindre. Je ferai les questions après la présentation des autres panélistes. Merci. Thank you so much for joining. I'll be going to the questions in no time. Our next panelist is from Slovenia, Andra Spocic. I hope I said it right. She's currently the head of community pharmacy in the small town of Mislinja. I hope I said it right as well. He has been working community pharmacy for over 10 years, and he considers pharmacies as more than a dispensary, so he's also very active pharmacist. For him, personalized approach to patient care is very important, and the community pharmacy can be a vital pulse for the town's well-being. Thank you so much, Andras, for joining, and I'll also be going to ask you very soon a couple of questions. Next on our list, we have Emanuela Tombe. She's a pharmacist in Relief International South Sudan, but also rapporteur for Pharmaceutical Society of South Sudan. So she's a pharmacist with 9 years of experience in pharmaceutical sector and 4 years in humanitarian sector. So she's been working with Sudan and South Sudan, and currently with Relief International, which she will probably tell us more about during her intervention. So she's working in emergency projects, and she's also, as I said before, the rapporteur for the Pharmaceutical Society of South Sudan. So thank you so much, Emanuela, for joining us today. And my last speaker for today, for the 5 speakers we have, is Waida El Sadiq. She's head of pharmacy practice department in the University of Medical Sciences Technology in Khartoum, Sudan. Waida has been also involved with us at FIP previously in some conversations with the problems that happen in Sudan. So we're looking forward also to understand a bit more, and how also the educational part of the university can also be put in practice to support the humanitarian sector. So welcome, Waida.
Thank you. Thank you very much.
So after all the presentations are done, I will now take down the slides and start the questions. But again, if you have any questions, please use the Q&A tool. So I'll ask all the panelists to turn on their cameras so we can all have a nice grid view. And again, encourage you to write some questions during the discussion. So I think we can start, and I'll start probably with Kwabena from Ghana, and we'll start with a simple question. Well, maybe it's not so simple, but if you can tell us a bit more about recent disaster situations in your country in the last year or so, if they're always the same situations, if you had differences, or if your country is more prone to a specific type of disaster. So can you tell us more about your country, emergency situations, and give us a first overview? So I'll start with you, Colin. Thank you so much.
Thank you very much, Rúben. And hello, colleagues. Good afternoon, good morning, good evening, wherever you are. So I'm here based in Accra, Ghana, and I would like to talk about a situation that occurred just a couple of months ago between September and October. So Ghana has a hydroelectric dam. So our electricity is provided dominantly by a hydroelectric dam. And the dam in Accra in Ghana is called the Akosombo Dam. And it is actually the third largest dam in the world. It's very huge. And because of the rain patterns this year, the amount of water that has gone into the dam has exceeded the amount that it can take. And so the authorities had to let some of the water out. And you can imagine the amount of water that came out of the dam, or that has come out of the dam, is so huge. It has caused flooding in the communities that lie along the path of the water. And it is estimated or reported that at the moment there are 31,000 people who have been displaced as a result of the flooding from the Akosombo Dam. The water has cut off access to schools, to hospitals, to homes. Bridges have been broken, roads cannot be accessed, and it's quite a horrible situation that has happened in our country. So the Pharmaceutical Society of Ghana has, when this thing happened, did 5 things, and I just want to briefly just mention them. So number one was that we wanted to also contribute to highlighting this issue across the nations. So we had a press release highlighting the issue, talking about the humanitarian situation, but then also uniquely calling for the authorities to establish a national emergency and public health fund. And the purpose of that was to be able to deal with these situations, especially when there are public health considerations in it. And this got a lot of traction in the media, and we are currently in engagement with the government to be able to see how this can be done. One of the things that we called for was that there was established during COVID a COVID fund, and that money in the COVID fund could be used as a seed money for this particular purpose. So that was at the national policy level. Then the second thing was that we have a team that works in the area where this flooding occurred as pharmacists. One of our branches is there. So the team went on the ground to assess the situation and then gave national reports on what the immediate relief needs were. People had been displaced, so their immediate needs immediately wasn't necessarily medicines, but things like mattresses, blankets, clean water, food, and at the national level, pharmacists came together and organized quite a significant amount of these items and donated them to the community immediately, led by the national leadership, and took the opportunity to also observe what was going on. The third thing was also then mobilization of medicines. Ghana has a fairly well-developed pharmaceutical manufacturing industry. So the Pharmaceutical Society of Ghana got in touch with the industry, and within a short time, medicines for chronic conditions who have lost those medicines in the flood and needed to get back on. So we linked with the health system to make those medicines available, in addition to a lot of other medications and intravenous infusions and other things for them. Then the next point was that we know a lot of our members also wanted an opportunity to connect and contribute to what was going on. So we created a platform, which was quite a slow process, but where our members could also contribute what they had, which is still ongoing, that we could also contribute to the areas as time goes on. And the last point is about continuous monitoring. So our teams are on the ground, continuing to monitor what is going on. We know that waterborne diseases there's likely to be an outbreak of waterborne diseases and other such conditions. So our teams are monitoring and informing the rest of pharmacists on what is going on the ground, human resource needs, then we can intervene where we need to. So that is the situation that has happened just in September and October that we are still working on in Ghana at the moment. And these are the interventions that we have put in place as a pharmaceutical society to help pharmacists contribute to the situation. And as the conversation goes on, we can elaborate further. Thank you.
Thank you so much. Thank you so much, Koen. It's very interesting to see using the pharmaceutical society as a tool to highlight, to raise awareness, raise funds, raise volunteers. So it's, I think this is a very notable process of using the society to bring these people into action and bring everything into action. And of course, it's unfortunate, the events that happen, but there needs to be a response, and not only during the recent months, as you said, like it was recent, but also in the medium or long term, it needs to be a continuous action for those that were affected. Thank you so much for this intervention. So next on my list, I'll have Andras. So I'll go to you also for some points on the situation in Slovenia. I think we also had some floods happening around this year. So can you tell us a bit more, similar to what Kavena just presented? Thank you.
Yes. Just a second. Okay. Yes. Thank you. My name is Andras, and I come from Slovenia. Thank you for inviting me. Today, I will share with you our experience with this year's floods in Slovenia. For those of you who don't know where Slovenia is, we're a European country. We're located in the Northern Balkans, just south of Austria. And I come from and I work in a small region called Koroška, or Carinthia in English. We are located here in the northern Slovenia, bordering Austria. There are 11 public community pharmacies in this area. We are all linked together, and we cover approximately 1,000 square kilometers and about 71,000 people. So this is an example of one of our pharmacies. This is how our workplace looks like, and this is how Slovenia looks like. It's a nice country. We have seaside, we have mountains, we have countrysides, plenty of nature, and some say it's a true fairy tale. But in this August, unfortunately, this fairy tale came to an end because floods affected our country. They affected actually 2/3 of Slovenia, cost approximately 10 billions with a B euros in damage. Unfortunately, we had 7 casualties, and most damage was done to our roads, energy, and residential infrastructure. And this is considered one of the biggest natural disasters in our history. So this is how everything looked like. Here are some pictures, actual pictures from these 2 days. Just to see the magnitude. This is actually from my hometown, from Prevalja. And this is from the town where I live now. This is from Žalec. So here's an actual footage from one of our pharmacies. It was also flooded. So what were consequences? Bridges were washed away. We had the roads cut off. There was no power supply, no drinking water, no mobile signal. Houses were obviously flooded and destroyed, and people lost absolutely everything, including supplies of their medicines. So this is what happened this August. Perhaps I will continue presentation when we go to the next part.
Thank you so much, Andras. It's important also to note the damage to the infrastructures, of course, because if there's no roads, for example, the medicines cannot arrive to the pharmacy. If people cannot move, they will not be able to also access the pharmacy. So even something so simple as a road can also have an impact on how people access care. And of course, in this case, with the floods, everything was displaced and it was very hard to mobilize people. Thank you so much for also showing some pictures to put this disaster into also in a more visual way, because I was not aware, for example, that it was 2/3 of the country. So it was quite a big impact to the country. Yes, thank you so much. I'll go back to you afterwards so we can continue the discussion. For now, I'll go to Huaida and ask her the same question. So what are the current disaster situations, maybe in the last year or so? How you've been characterizing these type of situations in Sudan? Huaida, floor is yours.
Hi. Thank you, FIP. Thank you for the opportunity, and I'm happy to be back. So probably most of you heard about Sudan in the news in the last few months. So just quickly to give you a background, like on the 15th of April of this year, a war suddenly broke out in Khartoum, the capital of Sudan. And it was sudden for all of us. I'm currently not in the country, but I was in the country during that time. And unfortunately, I had to leave with my family. Sudan is north of Africa. We are bordering many countries, including South Sudan. I know one of my colleagues from South Sudan is there. I mean, Sudan and South Sudan once used to be one country. Now we are 2 countries. We're bordering Egypt, Ethiopia, many other countries. And so different reason this war started in the capital, Khartoum. So, I mean, at that time, I am a pharmacist, but at that time, I was working as a lecturer and a head of a department in a pharmacy school in Khartoum. Honestly, at the beginning, it takes a lot of time before you can even think what needs to be done. And it took like 3 months to decide when and how to go back and what to do. So I'm going to talk like quickly as a pharmacist and as an educator. So obviously had commitment towards students. Obviously the first 2 months, it was about safety. The immediate need is safety. I mean, even on the day the war started, we had responsibility to make sure all students are safe out of the university. And I mean, after, I think it took us 2 months to try to just to come into terms to happen and to decide what to do next. As an educator, we tried to get hold of all these students. We had contact emails, what they want to do, what they think the next step will be. And I think it's after 2 months, the vast majority of students wanted to go back to education. And I can totally understand. I mean, for those, especially in their final year of studying, finishing their degree will like a hope or a light at the end of the tunnel. And hopefully things went well. If things did go well in Sudan, they can go back and contribute to the country and to the healthcare of the country, which is not in a very good situation, even without her. But for themselves as final year students, having this degree will open a huge opportunities for them. Some of them are still in Sudan, but they are in safer areas in Sudan. Others have left the country. And for all of them, just being involved in education is really the response we are getting, is just them that hope. And we try to be inventive. Obviously, with the COVID, remote learning became a very suitable option, continuing with education. But considering the war in Khartoum, and which affects, because Khartoum is the center, is the capital of the country. So unfortunately, every other part of Sudan is affected if it's not directly affected by the war. So the thing is the internet connection. So most of our students in Sudan have problems with the internet connection. So that's why the remote learning is very, very challenging, and the training as well. Most of them, I have to say, they have to support their families, so they'll start getting like maybe jobs with their studying. I mean, I can talk about what we're doing regarding their training, but let's just give you what's happening. As a pharmacist, we are just working, this is like effort from the pharmacists around who are contactable. We're making this network to try to locate where medicines are. So if you get an email, a message, a WhatsApp message that someone needs a drug somewhere is around Khartoum, we're trying to see if we can contact anybody to make sure that this pharmacy has got some insulin supply, some Parkinson medicine. We're trying to give sort of a medicine information advice, and we did that through the COVID times. So what can we do if we don't have, for example, I don't know, an enoxaparin, can we check to something else? So we're trying to provide medicine information, medicine information and supply advice. And there are agencies now in Sudan, Medicine Without Borders is the agency which is working. I believe till now it stopped for a while, but it's still working. And they're doing a great job. So some of the drug supply is through 8 agencies. And as I said, the problem is everything was in Khartoum. So once Khartoum is affected, all the other states around Khartoum are affected. And this is just a background situation now in Khartoum, where I used to live a few months ago. Thank you.
Thank you so much, Waida. So it's a bit different disaster situation. It's a war situation, not a natural disaster, but it's still worrying. We have similar situations happening across the globe as well. The issue of safety, of having to move, but also the interesting point you mentioned about the access to education, because people and students still need to learn, and education still needs to be provided. And of course, with the infrastructural problems, no access to internet, even the remote learning is a bit complicated. So thank you for your overview of this situation in Sudan. And we'll go across the border to Emanuela. So can you also provide us some insights of situation in the country and recent developments and some situations as well? Thank you.
All right, thank you very much, Rúben, and thank you everyone for joining. As people know, South Sudan is one of the youngest countries in the world, and South Sudan do face overlapping crises from floods, conflict, food insecurity, and of recent the crisis in Sudan, which is affecting Sudan as well. To briefly talk about floods, the country has faced massive floods in the past 4 years, and then it has destroyed homes, communities, and it has been, as of December 2022, more than 1 million people have been affected by flooding in the country in over 39 counties, including counties in Sobat River, and in Jungle and in Upper Nile. To shed light on the conflict, South Sudan has, since the independence, has experienced many conflicts. We can mention the 2013, 2016 conflict, and there is also some insecurity and conflict fueled by the subnational and the intercommunal violence that continue to be among one of the main drivers of humanitarian need in South Sudan. Food insecurity remain a problem in South Sudan. Approximately 5.8 million people, almost half the population of South Sudan, amounting to 46% of the population experience a high level of food insecurity, which is phase 3 or above IPC on the scale of the food insecurity. To shed light on the Sudan crisis, and I've seen my colleague here, Hoyd, has give us a background of the crisis in Sudan, which has started in April 2023. And in that sense, there is a latent influx of refugees and returnees coming from Sudan. Returnees who are South Sudanese people who stayed in Sudan, but due to the crisis, they have decided to come back home. Since the beginning of the war, so far, there is 388,933 individuals has been registered in the border counties between Sudan and South Sudan, and they are from different nationalities, up to 19 nationalities. Majority of them are South Sudanese, amounting to 88%, and the rest are Sudanese and some other nationalities, as the report released by UNHCR and IOM. The overall arrivals are female, half of the arrivals, and the other half are children below age of 18. At the border, there is 5 states bordering Sudan and South Sudan: Western Bahr al-Ghazal, Upper Nile, Unity, Northern Bahr al-Ghazal, and Abyei. And there's a registration taking place in about 22 areas. The main area where there is 83% of the registration, it's called Winthrop, or maybe you can call it Ring area, where the Relief International has established a transit center for receiving returnees and refugees. And RI is providing shelter, home, health services, and also nutrition services at the transit center. And from there, the returnees and refugees are being sent to their onward, or maybe the final destination where they want to settle at. The destination movement is supported by humanitarian assistance, amount at 48%. Government is supporting 29% of that. And some people are self-organized to move to other counties where it's safer and it has access to food and shelter. RI continue to provide food, nutrition, and health services and protection and in-kind cash assistance for returnees, and also to provide latrine construction all over the transit center, or maybe the areas where there is a lot of returnees and refugees. So far, the situation is calm, but there is still a need for more support to help people move to their final destination, and to also accommodate people within the ring and the transit center. Thank you.
Thank you, Manuela. So again, the problem of floods, which is common to other colleagues as well. And I think this can also link to some global events and maybe some pointers about the changing climate and the environment conditions that might be changing also across the globe, because we're also seeing different temperatures and different climate patterns where we wouldn't see them before. An interesting point about food insecurity, because that's a basic need to have food, to have clean food and proper food. And if that's not also happening, it's also quite a big problem. And then, of course, migration issues that are also important, because they happen across the globe. Other colleagues might also have the same situation of having different people crossing borders, and also the healthcare access for some people that might be registered in one country, they cross the border, they don't have any register. So there's also a big piece of information about this. So thank you so much, and I'll go back to you after for some questions. So now I'll go to Salami, and I'll pose the question in French, and then I'll go back to you with a summary in English. Monsieur Salami, merci une autre fois pour nous rejoindre. On a écouté des collègues de Ghana, Slovénie, de Soudan aussi. Il a des problèmes sur les pays. Et qu'est-ce que sont les problèmes au Maroc? On sait qu'il y a eu un tremblement de terre, par exemple. Et je sais parce que mon père aussi il me dit que 1960, il y avait aussi un autre tremblement de terre. Qu'est-ce que sont les problèmes plus importants au Maroc et comment un peu les pharmaciens agissent quand il y a quelque chose comme ça? Merci.
Merci, Rúben. Salut tout le monde. Tout d'abord, permettez-moi de vous exprimer ma grande joie de faire partie de la Fédération internationale pharmaceutique. Vous avez la traduction au fur et à mesure, là, ou bien?
Parce que je prends des notes et on fait au final, parce que comme ça vous pouvez faire l'intervention directe.
OK. J'ai le grand plaisir d'être avec vous aujourd'hui pour prendre part de ce webinaire et pour partager l'expérience des pharmaciens marocains durant et le vécu des pharmaciens marocains durant la dernière catastrophe qui a frappé notre pays, à savoir le séisme de la région de Haouz d'une magnitude de 6,9 sur l'échelle de Richter. La date de ce séisme qui a frappé notre pays, c'est le 8 septembre 2023 et qui a provoqué un bilan très lourd, plus de 3000 morts et plus de 6000 blessés. Juste après l'annonce de la catastrophe et en réponse aux instructions de Sa Majesté le roi Mohamed VI, tous les Marocains ont répondu présents, y compris la communauté pharmaceutique, en créant des comités bénévoles, des pharmaciens bénévoles, en coordination avec les syndicats des régions du Maroc, principalement des régions touchées, à savoir les villes de Marrakech et de Tsaroudant. Donc, toutes les instances du secteur pharmaceutique ont fait appel à l'ensemble des pharmaciens pour apporter l'aide et l'assistance nécessaires aux victimes. Du coup, les pharmaciens ont été chargés, on pourra avoir principalement la mission de la collecte et l'acheminement des médicaments et des dispositifs médicaux vers les zones sinistrées. Ceci principalement en collaboration avec nos confrères pharmaciens du secteur public et aussi nos confrères pharmaciens militaires marocains de la section. Les obstacles principaux qu'on a rencontrés, c'est principalement la topographie montagneuse de la région touchée qui a entravé et a mis en difficulté l'accès aux aides pour les personnes touchées et aux victimes. Il y a aussi un manque de citer le manque de coordination entre les différents protagonistes, aux acteurs à cette action humanitaire, du coup, qui a engendré pas mal de, soi-disant, de gaspillage de médicaments le moment de la collecte et de la délivrance aux personnes touchées. Pour les attentes, les besoins de la communauté des pharmaciens au niveau du Maroc, principalement, nous avons besoin de la formation en ce qui concerne la médecine ou la pharmacie des catastrophes. C'est un manque à notre pays, ça manque à notre pays. Aussi, peut-être il faut penser à associer le pharmacien, principalement le pharmacien d'officine, dans les plans de gestion de risque pour avoir les meilleurs, pour avoir une coordination efficace et rapide. Voilà, grosso modo, notre expérience vécue durant le 8 septembre 2023, durant le séisme qui a frappé notre pays.
Merci, Monsieur Nourdine. On a aussi des collègues de Maroc sur les chats que disent bonjour. Merci. Je ferai une traduction en anglais et après je reviendrai pour une autre question. Qu'est-ce qu'on peut faire peut-être après pour le futur? Il y a déjà des choses ici sur l'entraînement, mais je reviendrai. Thank you so much, Dr. Salami. I will now translate to English the main points. So, of course, the colleagues are happy to join this discussion in FIP. What affected Morocco was a very devastating earthquake this year. There was more than 3,000 deaths and over 6,000 injured. There was also a national appeal that pharmacists responded. So there was a lot of volunteers that engaged in this appeal. And the efforts they did was to collect medicines and medical devices to take to the victims of the earthquake. And there was also a good collaboration between the public and the military sector. So this was the first block of response of the disaster that happened. I think you might have saw in the news the disaster in Morocco, the houses that crumbled and the devastating earthquake. And Dr. Salami also pointed out what will be my next question, some barriers, some challenges. One of the complications they had was reaching the mountains because it was a zone with a lot of mountains. So this was harder to reach. So it was to get there, to get to the moment where we can help people. The infrastructure was complicated. There was also a lack of coordination between different players. So there was maybe not a good coordination between some of the actors that were doing the help, the support in the field. There was also some waste of medicines. Some medicines did not arrive. They could not arrive, and they were ended up wasting. And there's a couple of need for training points in disaster situations, but also as a need for training in risk management and assessing risk management situations. So we'll come back to the colleagues in Morocco, but these were the main takeaways. Merci une autre fois, Monsieur Nourdine. Je reviendrai après. Je demande à les autres questions à les autres collègues. So I'll go back to Kwabina, and this is the second point that will go now. So what are the needs for pharmacists in the region, and also what was the barriers and challenges that you find in your country regarding this humanitarian situation? So can you tell us a bit more which needs you have and what barriers or facilitators you can find?
Thank you very much, Rúben. So for us, it has been, this situation has presented as a good learning opportunity. And there are 4 things that we have identified generally that are opportunities for further developments. Number 1 is, and it generally borders on preparedness. So number 1 is that we've learned that the pharmaceutical society itself plays a critical role in the response. So there's a role for pharmacists individually, but we think that the role of the PHGH itself, that's the National Association, is important. So we found that, of course, like every emergency, normally nobody's prepared for it. So for us, the first thing is that there was a gap in terms of how we mobilize at the national level internally to be able to respond. So this was a gap which we have learned from. Of course, we're able to mobilize, but now we know how more effectively we can do that. So in our next budgeting cycle and all, we have made provision for such situations within our internal resources to be able to respond. The second one is on the assessment on the ground. Our association is quite decentralized. So for every region, there's a pharmaceutical society branch there. So we have determined that when anything like that happens, the first response will come from the regional branch, and they would go on the ground and conduct some sort of an assessment on what is happening on the ground. We have to fine-tune what that assessment will look like. Pharmacists who go on the ground should know exactly what they are going to look for and what answers would be efficient for proper planning purposes. So that's the shaping what the assessment will look like on the ground in an emergency situation is the next gap that we have identified that we are going to be working on. The next one is linkage with partners. So on the one hand, we wanted to make sure that we have the speed. We act very speedily in responding to the needs on the ground. But then also we noticed that we also need to collaborate with, for example, the Ministry of Health, Ghana Health System, Ghana Health Service, other professionals to be able to have some sort of a coordinated response in there. So the balance between responding speedily from the association's point and then collaboration with other stakeholders is also another gap that we need to figure out how we effectively do that. And then lastly, in terms of our pharmacists themselves, we know that health systems are going to be stretched because some health facilities have closed down now, and there's pressure on a few hospitals in there. And so as the numbers begin to build, how do pharmacies and pharmacists in these hospitals set up in a way that they can, with speed and efficiency, respond to the needs that come to them? So those are the gaps that we have identified and some of the ways that we are thinking about addressing them.
Thank you so much, Kobina. This is very interesting, especially the part of preparedness, because of course, as you said, you cannot be ready for the first time it happens, but you can be ready for the second time. And also you can be ready if you know that other colleagues had the similar situation. Of course, not all the countries are the same, but you can also learn some lessons from other colleagues. And that's why we're here today as well, trying to see other examples of colleagues. So thank you so much for these points. I noted them down. They're quite interesting. Also the assessment on the ground, going there, knowing what is needed, because one thing is what you see on the news and the other thing is going there and actually talking to people that are facing. So this is also very interesting, very relevant. And the point of linkage with partners is also interesting, because I saw there's a colleague from Argentina, Jorge, that also wrote in the chat that they are also doing some initiatives. So always having colleagues, always having the good networks is also very important, so we can all act to the same goal. I'll come back to you for a final question, but for now, I'll go to Andras, so we can let us know the barriers, facilitators, and the needs in the region. So following this presentation, perfect.
Yes, well, probably the biggest needs in our region, I mean, in Slovenia in general, is that we are understaffed. There's not enough of pharmacists in our country. So when a crisis like this happens, you are overwhelmed. Then, of course, the government funding, we get less money every year. So we have to find additional sources of income. And well, there's no training to be when you are in such a situation, because you're not prepared for this. So perhaps more training, like risk management situations, would be great for us. To go on about the barriers and challenges, well, it's not the situation that happens, but the days after are the real challenge, the real problem. Because in our situation, the next day when you woke up, you find out that your house is flooded, pharmacies are flooded, people can get to your pharmacy. You have no idea what is happening. There's no landline telephone, there's no cell phone signal. Because you can't get to your workplace, you don't know who will work at the pharmacy. You don't know how will you resupply your pharmacy. And because there's no electricity, you don't know what will you do with the cold chain. It's impossible to supply it. So solutions, solutions were crucial, and the best thing was that we really started really fast. The main question was who will coordinate everything, because as it was already said, in Morocco there was a problem because coordination was not as it should be. Luckily, in our case, we were coordinated, and we faced quite a few challenges. Floods happened in August. This is vacation time, and floods happened on Friday, so it was weekend, and you know it's tough. But luckily we don't go all on vacation at the same time, and we have a head of each community pharmacy, and we have a head of all our pharmacies, compared to a CEO in the corporate world. So we had a change in this position in July from Irina to Dragica, and they coordinated everything perfectly, and they helped a lot. Then solutions were internal and external, so meaning solutions for our pharmacies and for solutions to the society. But just to explain, luckily only one of our pharmacies was actually flooded. Others were just cut off. I mean, it was not okay. But if you consider the damage and the costs, it was okay. We had 3 other pharmacies completely cut off, and we had no idea about Cherna. This is one of our pharmacies that's the farthest away. What's going on there for 2 whole days. So internal solutions focused on our pharmacies and on us. Well, if your house is flooded, then just stay at home and help there, because you're useless to us at work. We had to regroup and we had to recover the flooded pharmacy, Prevalje, and we did this in the weekend. And then on Monday, pharmacy was back on, was opened again. So we did it in 2 days. People couldn't access our pharmacies, so we had to provide additional solutions, especially with the help of our army. About cold chain, well, we lost a lot of money there, so what can you do? We were assigned to the pharmacies that were nearest to us, and the ones we really could access. And about supplies, we had a delivery to the biggest pharmacies in reach, and then to the damaged pharmacies with the help of an army. And this is exactly how it looked like. These are actual pictures from these days. So yeah, they helped us a lot. External solutions to the society, to the community. We put a lot of information on social media, because social media is what gets attention these days. We offered plenty of personal help because in small towns we know each other and we really help each other out. Local radio stations were a big help. They were broadcasting important information for us, and also we put all the information on our website. Also, we opened all the pharmacies in the flooded areas during the weekend, and we didn't provide only emergency care, but we provided everything that was needed to the people. Of course, donations were a big help. We donated a lot of material to the army, to the fire department, to the people, and also other parts of Slovenia stepped together and donated to the affected regions. And I have to say that we're quite proud that on Tuesday, remember floods happened on Friday, but on Tuesday we had all our pharmacies working back again, including Cherna, which was really cut off for almost 3 days. So what about us? When you work in such a situation, you are stressed. That it's normal. You're not prepared for such a situation. Your nearest ones are affected. Your father's house is flooded. Grandmother is flooded. So we really communicated a lot. We used emails. We used cell phones. We also have a Facebook Messenger chat group. So we communicated there. We told each other what was going on, who needed help where, and we somehow made it through these times. And what we learned in these weeks, well, just like my friend from Morocco said, that fast and coordinated response is critical, and it is really important that the response is coordinated. I can't stress this out enough. It is also important to work closely with local communities and with authorities, police, fire department, army, also other healthcare providers, of course. You have to provide information to the community, and you have to provide information to your employees. And well, you just have to help when you can, because there is a lot of bureaucracy sometimes involved. But if you can bypass it and just help, this is really important, and just sort all the papers later. And what was the most important thing also for me was that I learned that our health system is ready for natural disasters, because we did not run out of supplies, and we really could provide people with everything they needed, because these were critical times. Yeah, so that's this bit from me, and this is a picture of all of us who were working in these weeks. So thank you.
Thank you so much, and thank you so much for highlighting the need for coordination, because I think this is indeed very important, so that everyone is doing what they need to do, not waste time, not waste resources. So yes. I think this is very, very important key message to highlight. And we're moving to the end of the session. So after going back to the questions, I'll also ask you for a key take-home message. I think this is probably one of them. Already jumping into this conclusion, but I'll come back to you as well. Thank you so much. So I'll move now to Huayda. Also, I think you already mentioned some of the barriers, some of the needs, but do you have any other points you want to add on the barriers, facilitators, needs in this particular situation that you've been living in the last months?
Yes, I mean, obviously it's when disasters happen that you start to think about the if only we had this, if only we had this. So I mean, now we're trying, as like from an education point of view, we're trying to provide this online teaching. But I now think if we had more access to, I know the internet is an issue, but I know now, like with all these inventions, the simulated learning, all these apps that are available online, which can like mimic a ward situation or mimic a community pharmacy situation. If we can have access to this, I know maybe some of them cost a lot of money, but if we can have, because the training is the main issue. I mean, we can provide the knowledge, even if they don't have this very good internet. We can register, we can record our the lectures, we can send it to them, they can listen to it whenever they have connections. But the real challenge is the practical training for pharmacists, and especially final year students. They should have spent most of the time in a hospital situation, in a hospital environment or a community pharmacy. So like now trying to think how we can do that remotely, how we can get I don't know, any apps that can assist. And again, pharmacist, I'm thinking about supply and advice. If we have like a platform, an emergency platform. I mean, we had a experience from the COVID. I mean, I don't know, maybe we started doing things about how people can contact a telephone number to know where drugs are. For example, if it's located in a faraway pharmacy, in a remote place, can it be delivered and things like that? Especially medicine information advice. I mean, I was a medicine information pharmacist before becoming a lecturer. So there are small things that you can give to patients, even prescribers. They can just change one medicine to another, and we can resolve the issue for the time being. So I think, as we say, like when things happen, you start thinking about all the things that could have, or can start doing them to prevent similar scenarios or similar other catastrophes, if you can say. Thank you.
Thank you so much. Indeed, very important the aspect of practical training, because if you go to your profession and you never had contact with any real situation, that's probably complicated. But there's indeed maybe someone somewhere already has developed this training, these simulators, and maybe there could be a collaboration where these partnerships could allow access to these platforms, for example. So thank you very much, Huayda, for this insight. And I'll go to Emanuela as well for the last around on the barriers, the challenges, the needs that you face in your country.
Thank you very much, Rúben. To talk about the needs, as my colleague mentioned a few of them, there is a need for capacity building of health staff who are managing pharmaceutical or who are doing inventory management and supply chain management, because we've noticed there is a lot of waste and damage because of lack of proper management, as well as there is a need for more pharmacists within the country. If I may estimate, maybe the number of pharmacists within the country will not exceed maybe 1,000. There is also need for collaboration with stockholders for better response to emergencies. There is also this need for pharmacists to be in the pharmaceutical quality control to increase patient safety. As we import medication, we need to make sure that the medication that we have on hand are safe and secure for the patient consumption. And also the country, like the Pharmacovigilance Center for reporting of drug adverse reaction, it's very important to do that. And also there is also need for increased budget allocation from the government, as the current budget is not really sustaining the health system, and we need to improve on that. As the health system is quite fragile, any slight emergencies stretch the health system. To quickly move on the challenges and that we find in emergencies, as a pharmacist working with Relief International, sourcing pharmaceutical supplies within South Sudan is a quite lengthy process. To get good quality medication in short time is a challenge. Put into consideration the donor requirement and also the organization policies, it takes a lot of time, and also the timely distribution of medical supplies to the field location, as this is being challenged with the roads, the access, the weather. So many factors hinder the distribution of medical supplies. And with Relief International, we overcome that by establishing within country buffer stock that is ready for distribution as soon as there is an emergency. And this is exactly what we did in the rain response, as Relief International, excuse me, initiated the response on 28th of April. Quickly on the 1st of May, RI was able to reposition essential medical supplies to RENG to support the refugees and returnees. And also there is a challenge of internet and communication with the field location, limited funding, as by next year there will be a 50% cut of funds to South Sudan. And lastly is the security and access to field location. And as of August, there is about 22 health workers who were killed, and it's quite challenging. So I will stop here. Thank you.
Thank you so much, Emmanuel. I see there's a big list of barriers and issues to be solved, so that's always complicated. Where do you start? But we have also a comment on the chat regarding the challenges of supply chain, and I think you mentioned some of those. Not only the access itself, but also the quality control or the funding to get this medicine. So there's, I think there could be just a webinar just for this access and supply chain aspect of it. But also the capacity building, because if you don't have the pharmacists and that they are not trained, then they can also they don't help that much. So the last point you mentioned also, it's the security. So having health workers in danger is also complicated, and this is more likely also in these disaster situations. So thank you very much for your intervention. So I think we have around 10 minutes before the end. So what we'll do is I'll ask our last question together with the take-home message. So and I'll start in French with Salami. So my question will be, what can FIP do? Is there any future perspectives? And if you have a key take-home message together in a short intervention up to a minute. So Monsieur Salami, on est presque à la fin de la journée ici, on a 10 minutes, mais la dernière question c'est qu'est-ce que la FIP peut faire pour aider, et ça c'est une réponse petite, 1 minute, et aussi s'il y a un message principal pour tout le monde ici avant de terminer.
Merci, Rúben. Alors, pour la dernière question, je pense qu'il faut insister sur la formation, comme j'ai dit tout à l'heure. Donc, c'est sur la formation sur la pharmacie, la médecine des catastrophes. C'est très important. Il faut penser aussi à comment optimiser la coordination entre le secteur privé au Maroc et l'État. Nous avons un secteur privé qui est très performant. Les pharmaciens d'officine sont présents pratiquement partout au Maroc. Nous avons une chaîne de distribution, un réseau de distribution des grossistes répartiteurs qui couvrent le Maroc tout entier. Donc nous avons un potentiel énorme, mais malheureusement, en cas de catastrophe, il y a un manque de coordination entre le public et le privé. Donc il faut penser à peut-être à une plateforme digitale ou numérique qui va optimiser cette coordination et avoir l'information utile le moment opportun. Et aussi, il faut impliquer le pharmacien, vu sa formation, vu sa disponibilité, vu son parcours académique, l'impliquer et l'associer aussi dans les plans de gestion de risque de l'État. Je crois que ce sont mes 3 principaux messages que je veux véhiculer. Je remercie énormément la FIP pour cette opportunité et à la prochaine, Inch'Allah.
Merci, on reste en contact. In summary, 3 main areas. One is training is needed, especially in this area of disaster management. In Morocco, they have a very strong private sector, so there's need for more collaboration between private and public sector, and maybe a digital platform can be helpful to gather this collaboration. And it's also important to involve pharmacies themselves in risk management strategies together with the public sector. So thank you so much, Monsieur Salami. Merci. So I'll go now to Kwabina for the last one. What can FIP do? What can you see in the future? And also a very short key take-home message from your side.
Thank you, Rúben. First of all, like I said in the assessment situation, I think that we can all come together and develop pharmacy-specific emergency response guidelines for pharmacists when we go into a situation, exactly what we need to do and all. And I'm grateful that you shared about the presentation that was shared earlier on by FIP. I think it's a good resource that personally I'll go back and look at again and see what we can work with. The second thing that FIP can do is something like this, to create platforms where such experiences can be shared for other people who haven't been through it, or even those who have been through it could also learn where they could improve or even do better. So the opportunity to FIP has to create these platforms is something that I highly support, and I think that we should continue to do. And then the last thing is that, and I think take of my colleague from Morocco, we also need to explore how we can use digital technology to be able to coordinate this effort on the ground to be more efficient, and also to deliver these services in a speedily way. So those are my 3 things that I think FIP can lead on. But my key takeaway is that from the experience we've had and everything that has been shared, it is clear that pharmacists are willing and ready to support in emergency situation. And with the right recognition and capacity building, we can bring real value to emergency situation. And you know, in the presentation that you shared, you talked about the role of FIP in highlighting at the global level the role of pharmacists in such situations. I think that is extremely key. And once we can do that and bring more and more recognition to the role that pharmacists play, we can indeed bring real value to these situations. So that would be my key takeaway. Thank you very much.
Thank you so much. Thank you for joining. This is indeed important. Pharmacists are there. They might just need a guidance or a push to know where they can engage. So that's That's perfect. So let me go now to Andras for a final message.
Yes, as my colleagues already said, what we could do, these are all great suggestions, and I support them as well, especially training or workshops on this topic, on crisis management, risk management. We're not trained for that. So this really could be a great benefit for us. And well, my key takeaway would be, when a crisis comes, you just have to work together. You have to step up, and you have to help. This is why we are actually here. We're here for the patient. We are here for the community, and in situations like this, people need you. They need you 24/7, and this is actually your job to do it.
Thank you so much. So also having this proactive mindset of going to it and facing the challenge. But of course, more training and more resources can be also useful to be more comfortable in reaching this situation. So I'll go to Huayda now for a final message.
So I don't have much to add. It's all been said, the guidelines, the technology, and the FIP can help with that. So we know exactly where to go when D6, hopefully we don't need to go through them again, but if anything happened anywhere in the world, we know that all this pharmacy community, together with the FIP, they have this 2-3 things to do at the beginning. They have the advice, the medicine information, they know the links, the supply, even the organization on the ground that can help. So all this will be like something that we can think about together as pharmacists from different parts of the world with the help of the FIP.
Thank you so much. Thank you so much for these nice words. And now to finalize, let's go to Emanuela for any final messages.
Thank you very much. And I do agree, all has been said, but what can FIB do? As like it's already being in the process, like the advocacy for the important role of pharmacists, as well as the capacity building of pharmacists if possible. And as my colleagues mentioned, the resource sharing, SOPs, strategies that will better prepare us for handling emergency situation. My takeaway message, the role of pharmacists is crucial in the health systems and as well as the humanitarian sector. Thank you very much.
Thank you so much. Thank you so much for your thoughts, for your contributions. I think I would need probably another 30 minutes to wrap up and bring all the important things that were said. But of course, we had different disasters that colleagues presented. Some were natural, like the floods. Some were conflicts, like the war. So there are different types of disaster, and these have different impacts. Also, the earthquake that happened in Morocco. So important aspects that were highlighted include being prepared, being trained. The training aspect is also important. Regarding teaching, is also important that there's an access to education, but also collaborations, because some people might be doing the same or might be going to the locals, and we can collaborate with them. So one important thing was coordination. We saw that this was important. And also, as you saw in one of the examples, supporting by, for example, the army was helpful for the logistics, but also the aspect of providing correct information for people, providing a hotline, providing some place where people can go and find their information, but also their medicines. So ideas is to have pharmacists involved in risk management strategies, but also more training. The digital can be a solution. Digital platforms can also help shape these interventions in these situations, but also important to share good practices so we can be more prepared every time a new disaster will come, because more disasters will come and we'll have more and more around the years. So this is the time to close. Thank you so much, everyone. You will see the recording of the event on this website, events.fip.org. You can also send to webinars@fip.org if you have any questions, if you have any suggestions for other events. Please reach out if you want to contact any of the colleagues for any information on sharing anything at all. And with this, I thank you all. Thank you all the speakers. Merci tout le monde. Thank you for being here with us today, and I hope you liked this FIP digital event. Thank you so much.
Thank you. Thank you very much.
Thank you very much.
Merci beaucoup.
Thank you. Bye.
Bye. Merci.
Thank you. Bye.